I think one thing that we have learned over the past few months is that COVID-19 isn't really containable. There were at the beginning some hopes that it might be contained in China, and by the middle of February, end of February, it looked as if there was at least an equal chance it could be contained. But subsequent events have shown that it can't be, and it subsequently spread across the whole world. In retrospect, and of course it's always easy to say things in retrospect, but we probably were a little ambitious thinking that we could contain a respiratory virus like this one. Respiratory viruses have very wide areas because of the coughing and the sneezing where you can have contacts, so consequently it's very difficult to trace contacts. And we also now know that probably somewhere between a quarter to a half of cases are infected by somebody who is either asymptomatic, meaning they don't have symptoms at all, or pre-symptomatic, so they'll go on to develop symptoms. So that's one of the main lessons, I think, is that this thing is not going to be controllable. We just have to try to slow it down as much as we can while we either wait for a vaccine to be developed, which still unfortunately looks quite a way off, or we gradually ease ourselves towards herd immunity, which isn't going to be a very comfortable process because it will mean that there will be many more people infected, and unfortunately many more people will also die. So getting ourselves down from the peak is going to be a tricky operation, but it's something that we have to start thinking about doing now in areas where we're reasonably confident that the peak of the pandemic has passed.
I want to come back to your point, and we heard a new study today coming out suggesting exactly what you just said, that in fact the virus could be the most contagious 2 days before symptoms show up, and there are some people that are asymptomatic. Does that explain its rapid spread, and how do we then try and contain a second, third or fourth wave?
The rapidity of spread is due to a mixture of factors. One of them is the contagiousness of the virus, but the other one is the serial interval, which is the time between the onset of symptoms in one person and the onset of symptoms in the next person in that transmission chain, which can be as short as about 5 days. So a traditional public health test, trace, isolate scenario strategy is something which is very difficult to apply to a respiratory virus of this kind, because you have very limited time to get to the contacts, even if you can identify them. And with a virus like COVID-19, probably most of the contacts are non-identifiable. There's a contrast with things, for instance, like Ebola virus, which is also very infectious, but you're only at risk of Ebola virus if you're in almost skin-to-skin contact with an infected case. You have to be in really close proximity, which means that when epidemiologists are handling an Ebola virus outbreak, as they have been doing over the past few years in Africa, they can identify a small number of contacts, and then they have more time to get to them, because the serial interval for Ebola virus is about a week to 10 days. So the statistic that Ebola virus and coronavirus are equally infectious in terms of their reproduction number hides a very big difference in the way the virus is spread, and respiratory viruses are inherently resistant to this kind of strategy, which does work quite well for things like Ebola virus. So I'm a bit sceptical that the test, trace, isolate technique will help in this case. I think we have to accept that the virus is very difficult to control, and it's just hygiene and social distancing to try to minimise the amount of spread. It's a little bit like we would handle any kind of flu outbreak, whether it be a seasonal flu or a pandemic flu. We didn't try to contain swine flu in 2009. It wasn't believed to be something that was worthwhile doing, and probably, again, as I say, in retrospect now, we realise that we're in something of a similar situation with COVID-19. The difference, of course, though, is that COVID-19 has a far higher case fatality rate, a far higher mortality rate than the swine flu did in 2009. So the consequences of managing the exit strategy from the pandemic badly will be much more severe than they were for a flu pandemic like the one we had in 2009, which was milder.
Yeah, so to that point, how do you think it should be managed? So do you think there still should be some level of containment and sort of weigh that balance of getting the economies back on track, but but still keep some level of containment just to minimise the spread with those regular things of social distancing and washing hands, etc.?
Yes, reopening the economy from lockdown could well take place in a phased manner. So countries that have areas that have passed the peak, where hospital admissions for COVID-19 are coming down, where intensive care units are not overloaded, they might choose to relax some restrictions on an area by area basis. Of course, this might cause some internal political problems in countries if people perceive their area to be unfairly treated. If, say, the government were allowing one city to reopen some shops and so on, but another city not to. So there's a political risk there. Another possibility is that we could relax the restrictions according to age, because younger people have far lower mortality rate than older people. It means that allowing them to come out from lockdown is less personally risky to them. But again, it places law enforcement in a difficult position of trying to decide who has the right to be out on the street, who has the right to be in a shop based on age, which would be very, very difficult, I think, situation to put law enforcement in. So neither of these things is perfect. They have logistical problems and they have management problems. But doing something in a phased manner would be infinitely preferable to suddenly lifting a lockdown over a whole country, because then we might get a second surge of cases, and hospitals might once again see signs that they're overloading. Fortunately, in the UK so far, we haven't actually reached capacity yet, and our outbreak here is in a kind of a flat stage, but it hasn't started coming down yet. Where we've seen really serious consequences on health systems, notably in Wuhan City at the beginning, then subsequently in northern Italy, and in New York City most recently. Those things are not indicative of the fact that the authorities in those places are doing anything wrong. It's simply bad luck on their part that they've had waves of infection that have all been hitting the hospital at the same time, and therefore the intensive care units have been filling up simultaneously.
Indeed. And Derek, just briefly, we're seeing in South Korea some reports that about 141 cases have retested positively. Does that gel with you? Does that make sense to you?
Well, if by retested positively you mean people that had previously tested positive then negative,
yes, and then positive again.
Yeah, we've seen that since the beginning, and it's possibly due to problems with the test, the second test, that they've had a negative test, which is actually a false negative the second time around. Generally, we believe that people will cease to shed virus and cease to be infectious round about a 1 week period, which is also in cases that recover about the time that they start to feel better. And then after that 1 week, the first 10 days have passed, it's those people that are still suffering symptoms and still shedding virus that are a cause for concern, and those are the ones that often end up in the intensive care unit. I think at the moment it's unlikely that it indicates reinfection, as some people have suggested. Probably reinfection is not something that would occur unless you were exposed to a high dose of the virus and you had no acquired immunity from your first encounter, which both of those things I think are fairly unlikely. So where we have apparent reinfection, I think it's probably a technical error.
Derek, appreciate as always your insights. Thank you very much.
My pleasure.